The first thing we did was to educate ourselves onto what this meant for transplant patients. And so our task force, our strike force in early March, worked together to figure out what this meant for our transplant patients. We developed multidisciplinary rounds. We worked with infectious disease, hepatology, nephrology, and a whole host of others to figure out what this meant. Once we did that, we worked with national organizations and our colleagues around the country, nationally and internationally, to figure out what best practices are, because a lot of this was unknown and is unknown. So we have spent our time developing protocols, developing policies to keep our patients safe. There are a number of patients who don't have the option to wait for transplants. Those with fulminant liver failure, those who don't have the luxury to wait at home for 2 months. That's sometimes a difficult decision to make, to weigh that risk and benefit. But that's something that we do as a team. That's something we've done early on. There's some patients that it would be nice to wait a few months as they get better, but it turns out with their liver disease, kidney disease, heart disease, they're not going to get better. And it's those patients that can't wait that we really need to push forward. Here at Atrium Transplant Center, our commitment is to patient safety while providing life-saving transplants. We feel very comfortable that we have updated our processes, updated our policies to make transplant safe for these patients, to make transplant a safe environment for our teammates, for our patients and their families. And so we do know that if things change here in the Mecklenburg County, Charlotte area, if things change nationwide, we are in a good situation to pivot with those changes, to have a plan B. Atrium Health has done amazing work treating COVID-19 and being on the forefront of treating COVID-19. And so that is part of our preparation, is that if a transplant patient were to develop COVID-19, what do we do then? We're prepared for that as well. We feel very comfortable that the Transplant Center is up for the challenge.